Welcome everybody to today's session, Better Care at the Edge. Can I just see those of you, can I get a couple of chat sessions in as we go through, just to let us know that you can hear us and you can see us through today's session. I'll just get started as we get through, and I'd like to thank you all for attending today's session. I'm very excited. We'll be talking about Better Care at the Edge. And I'm quite fortunately joined here today by Ron Robinson from St Andrews Toowoomba Hospital, who's going to put a practical spin on what it's really like trying to live with the day-to-day issues in a healthcare facility. And also Darren Smith from Aruba Networks, who's going to help us understand the forward-looking and current solution set available, where Aruba Networks, or HPE Aruba, have been investing quite heavily in the health and social services sector. Before we get straight into it, what I'd like to do is just share some housekeeping matters with you here today. So we have a chat tab open. If my memory serves me correctly, it's in the right-hand side of your window. Please feel free, as we go through today, put your questions through. We'll get to them. If we get a chance, we'll answer the questions on the fly. If we can't, we have Andrew, who's sitting here in the background as a moderator, who'll help us collate and answer the questions towards the end of today's session. If you also have any technical difficulties, please do put them through as questions on today's session, and we will attend to them, or Andrew will do his best to help sort you out while we go through today's session. The session is being recorded, so if you miss anything, you will be emailed a link afterwards after today's session. So without any further ado, the way we'll get today's session running is we're going to describe and walk through a few of the issues in the delivery of best-in-class healthcare and social services with Darren and Ron. So what we have here is I think it's referred to as a quadruple aim in the health and social services sector of improvement in patient experience, dealing with the day-to-day issues with population health, both from a physical and a mental standpoint, the constant balancing act of innovation and delivery of best-in-class services, whilst at the same time cost reduction, and also taking care of the people who are delivering the services and care team wellbeing. What I'll do is I'll just walk through a few of these issues, and to preserve a little bit of bandwidth while we're all doing this, I'll just take myself off the video to go through this slide, and I'll also ask Ron if you'd be kind enough, as I walk through some of these issues, or point what these issues are out in the industry, if you could be kind enough to just expand on the relevance as it relates to your experience. So,
yep, happy to do so.
I greatly appreciate it. One of the big ones here, and I'll straight up and down at 12 o'clock, where to go and how to get there. I understand that your facility is in Toowoomba, so it's not necessarily what one would classify as an inner CBD facility, but are there any challenges that you face on a day-to-day basis related to patients, guests, etc., who are coming to St Andrews Toowoomba Hospital in the general concept of where do I go and how do I get there?
Yeah, actually we do. So we're a 155-bed facility on the Darling Downs, and we support 378 VMOs, and we have 55 tenancies that some of those VMOs occupy on campus here. So we're quite spread out, and we have 9 entrances to the hospital. So it's one of the current issues that we're facing in the hospital is how do we get people efficiently through the hallways and to their destination so that they can get to the clinics, doctor's appointments, theatre times, just to keep everything flowing. So Wayfinder solutions, virtual concierges, whatever they want to call them these days, is certainly something that we're looking at currently.
Yeah, very, very interesting that you that even you face that issue even in a regional area. So the next issue here is the in-home care and community care. So I think it's been done to death, but it's still relevant. COVID-19 really pushed the barrow and accelerated both the challenges we're facing today with aging population, the ever increasing expenses inside a facility to deliver health services, but at the same time, the desire and the improvement and the scientific or evidence that in-home care and community care is actually better. Do you have any experiences through the pandemic, even though you are a hospital, where in-home or community care is an avenue that's being looked at?
Yeah, community care isn't something we're generally looking at the moment, but some of the synergies that you would find through in-home care, we've actually had to apply through COVID in preparation for being able to treat people, put them in isolation, and still get effectively in-house telehealth delivered. But there's a lot of lessons in there for us when we face, for example, COVID 2.0. How do we deliver services more efficiently? What can COVID teach us that we can be more prepared for in the future? So being able to support people in their homes is certainly something high on our agenda.
Very, very interesting, which I think leads to the next one, which from an external perspective, or I guess from an organisation such as Arion, who would work with organisations like yours to help integrate and innovate and also operationally support and maintain the technology that supports the organisation. I was shocked to hear from you, previous to today's session, about the government regulations and forced intervention that you faced over the last 12 months and potentially are now going to face again. I'll draw to it quite bluntly. My understanding is you were forced by and many organisations like yours were forced by the government as it relates to how beds are to be utilised for COVID-19.
100%. We faced a multitude of issues, not just around, and I mean, this is a technology forum, so I'll try and keep it technology centric, but we faced a multitude of issues when it came to how COVID affects us and how we do business. Everything from, like I said, telehealth in the rooms here, even internally, how doctors can traverse their different networks to be able to provide health from their own clinics back into the hospital. But even simple things that you would never take into consideration. How do you allow people efficiently through the front door while having to go through a check-in app and making sure that all of the checks and balances are done? The hurried purchases of thermal cameras and alerting systems, which you would never have considered previously. So all of these things, I think, are lessons. Everything in life is a lesson, but we need to take the lessons as we did from COVID, and when COVID 2.0 or whatever the next thing is, hopefully we're a little bit more ready.
Yeah. What about the current situation? So I'm reading in the press now, and I don't know if it's real or not, so hence I'm going to ask. The vaccination is the next big thing. So is there an impact on the potential of mandate on how you will and will not potentially behave in that area?
Yeah, look, there certainly will be. I mean, just the fact that people are coming here to be vaccinated, there would be a risk involved in that. And we actually have an in-house committee that is taking care of the COVID situation. And as we've done previously, we've had to set up external touch points where the patients can come through and be tested. We'll have a very similar thing when they come through and be vaccinated. The fact that they're coming here means that they're probably a little bit aware of the fact that they might be susceptible to COVID. So I would imagine that would be an on campus, but outside of the core part of the hospital.
Very interesting, isn't it? I'd love to hear, just so the audience is aware, we have Darren, who is going to walk through some of the investments and innovations that Aruba has made in this area, and I'd be very interested to hear what and how they're tackling some of these scenarios as we go on to the next phase of today's session. But I guess as we move through some of these issues, talk to me. I mean, I think it's pretty obvious that cybersecurity is important for a hospital facility, but can you expand on that one?
Look, I think let's when it comes to cybersecurity, let's put it out here on the table. Any organisation, underline, bold, italics, any organisation that doesn't consider cyber security as one of its premium risk factors is already in a losing situation. They're setting themselves up to failure. One of the things I did, and I've only been here for a short period of time in relative terms, but one of the first things I do in any organisation that I get involved with is I run a vulnerability and pen testing exercise just to benchmark what am I walking into. So one of the findings, and I've done that twice since I've been here, one of the findings which was pertinent to us was an aging technology fleet and the risks that are associated with. It's kind of pertinent that Aruba's on this call because they're the solution that I went with after extensive evaluation. Probably one of the reasons why you've asked me to be on this call. But we found that cybersecurity, you're often looking at phishing campaigns, people clicking on the wrong links, those sorts of things. Well, we had grassroots issues here, and that was we had an aged network fleet, and they came up red hot. They came up as one of the critical issues on the pen testing exercise because we had, I won't mention names, but we had a mismatch of different technologies running our network. And some of those hadn't even been supported by the vendors in over 12 years. So it was one of those sort of low-hanging fruits that we could protect ourselves quite quickly. And not because they're on the line, but Aruba was certainly up in the top right-hand corner of the Gartner quadrant. It ticked all the boxes I needed. Plus, it also provided me with an opportunity to expand the capability of the hospital with technologies and functions that we didn't previously have access to, that we do now with this technology.
That is very, very interesting. That the way that you initiate a benchmark or a baseline is via a third-party independent, whether you call it a penetration test or a security assessment to understand the current state of technology. Very, very interesting. As we move forward there, I'll try to put the reputation of the ICT function from a different perspective, because I think it's, this has been done and dusted over and over. But I've read recently a report, I think it's by the Royal Commission, and it wasn't related to private hospitals, but I think it's to your industry in general, that aged care facilities operate somewhere in the vicinity of, a $6 a day meal allowance, is what they've got budgeted, is what they've got as affordability. And that's, and to me, I consider that as well, imagine how limited your IT funds must be, and balancing that with operations and also innovating and providing additional care.
Yeah, look, funding is always going to be a problem for IT departments. It doesn't matter whether you're private or public sector. Funding is always going to be an issue. I think one of the things that I've learned through my career, and I've been lucky enough to wear a few different hats, but it's identifying what gives us the best bang for our buck when it comes to technology and our budgets. There's nothing worse for an IT department when you have technology that fails you. As an example, here at St Andrews, like I said, we support over 370 visiting doctors. There's nothing that impacts on an IT department's reputation, or the hospital's reputation, more so, in the fact that the doctors can't perform their basic functions. They can't get remote access to their clinics. They can't get access to web pages that has fundamental information for their processes. The medical devices that they're using don't talk to the network and give them the alerts that they're required. So IT, as much as it's a sort of forgotten thing in the back end of most systems, we are a business enabler. The reputation of the hospital and the IT department take a hit when the technologies just don't work.
Yeah, and I could, moving forward, I could only imagine the challenges as it relates, because instead of a budgetary concern there, you've really referenced service availability. So yeah, service availability must be also a challenge, when I could only assume the width of different devices that enter your network would be just phenomenal. With the what did you say, north of 300 different consulting physicians visit your facility? Yeah,
there's over, I think from memory, and don't quote me on this, but I think we support 378 VMOs, or visiting medical officers. So, and they range everywhere. They come up from Brisbane, the Darling Downs, south of here. They come out from out west, north. Some of them practice quite often in the hospital. Some of them practice once or twice a year. But of course, they come from different organisations and have different expectations. And my goal for this organisation is to make sure that, from an IT perspective, that I excel and provide them with a service they aren't getting anywhere else.
How do you handle the devices on the network? Because I'm assuming that not every single device is a normal PC or notebook.
No. Well, it's interesting that you single in on devices there. So there was a recent study, and I can't remember where it was done, but it was identified that 40% of medical devices in a hospital are a cybersecurity risk to that organisation. So recently here, we've upgraded a lot of our technologies. We've, pumps, vital sign monitors, all sorts of things. So over the last 2 years, I've brought on in excess of 260 medical devices, whether they be connected via Wi-Fi, whether they're connected via LAN connections, or whether they're collect and deposit later devices. So having to identify those things on the network and make sure there's nothing erroneous going on, there's no one playing any games or no one that's piggybacking off of the signals that are there is fundamental to the assessment before you bring them onto your network. It's one of the things that we monitor and control quite heavily here. I have a network guy on staff here, and his job is to make sure that those things are protected. And then through our partnership with Arian, then we have that third level escalation, just as a checks and balances to make sure that we're figuring it right. But we also offer, and this is something that a lot of people don't consider because it's kind of a nothing situation. When I first got to our organisation, we have what we call here a Wi-Fi guest network. It's just purely guest. But we had, through our pen testing exercise, we identified 6 different tunnels that were created between our guest network and our corporate network. Now, no one knew they were even there from an IT perspective internally. That's a massive security risk. We've got 155 beds. You can imagine on average 3.2 people as visitors to each person that's here across the span of a day. That equates to a lot of mobile phones, a lot of iPads, a lot of personal devices that are on my network. Now, with those kind of security holes, that's a massive risk to an organisation. So again, it's around that benchmarking with the cybersecurity and pen testing or vulnerability assessment we did, was identifying those gaps and closing them out. Devices that you don't control are always going to be a risk, just as much as clicking a link in an email you shouldn't click.
Talking about devices, I'll skip a little bit here into an asset management question. Do you find that you've got any issues with, what's the question relating to here? Expensive medical equipment that can't be found when you have a need, or in general, it's a bit of a challenge from an asset management perspective.
Well, I'll tell you what, when you're in the check on every let's break it down a little bit more basic than that. Wheelchairs, 5,000 or 6,000.
But what I think the message Ron was trying to get across there was that if I could hear in and out was that there was $5,000 or $6,000 per wheelchair. Now, I think the scenario quite simply was that if you can't find a wheelchair when you need it, more likely than not, there may be a requisition to procure another handful. But then when you find them again, or alternatively, if they've left the building not to be found, that's a bit of a problem, quite an expensive problem. I'll move forward. We might jump back again. We may not. I'm going to allow Darren the opportunity while Ron's joining again to just walk through a couple of the areas. Darren, I'll move us through to the next slide. If you'd be kind enough to just walk through some of these, some of the areas that Aruba's been making the investment in to help support some of these challenges.
Thanks, Dean. And it's good that Ron actually discussed some of these issues in a sort of real life example. So what I want to do now is kind of touch on what we at Aruba are doing to sort of help some of the issues that Ron raised just then. So this is sort of a high level slide here that really sort of explaining how technology can actually help when you're trying to deliver healthcare and sort of social services inside your organization. So some of these areas Ron touched on, and I'll go into a bit of detail, but certainly some of the key things here would be wayfinding as a key example, especially in the larger facilities. How can you actually ensure that visitors or patients at your facility actually know where they need to go? I remember there was a study done a number of years ago where they actually researched a couple of large hospitals, and it turned out that a lot of doctors and nurses' time was actually spent giving people directions. Now, the reason for that, if you walk into, let's say, a hospital and you're trying to find a certain place, if you see somebody that's a doctor or a nurse, you know that they work in that hospital, even though there could be other people around you that you might not be able to identify as working there. So quite often people will go up to a doctor or a nurse and ask them for directions somewhere. So things like wayfinding are very important. Ron covered around data breaches. Obviously, when you're dealing with things like patient records and other sensitive information like that, it's really important to ensure that your network is secure as possible. Looking at things like medical IoT, healthcare is one of them areas that has really embraced IoT as a technology. There are lots and lots of weird and wonderful devices that do get connected to healthcare networks, whether it's imaging machines, monitoring machines, and anything else like that. Even down to, we are seeing healthcare in the US now, where they're using things like, imagine things like your Apple Watch or your smartwatch to actually monitor vital statistics of people, not only when they're in the hospital, but also when they've been released to home as well. So lots and lots of different ways here that technology can help. And what I wanted to do is just step through these couple of different areas here. So if we look at the patient and guest experience, as Aruba Networks, we've been doing a lot of work over the years in the hospitality industry, so hotels and things like that. What we're actually now seeing is hospitals are almost now treating some of their rooms kind of like that hotel room-like experience. Patients are expecting some of them similar services that you might get in a hotel. So it's been really easy for us to adapt some of the solutions and technologies that we actually deploy today in the hospitality industry into healthcare. So I mentioned around things like location earlier. So wayfinding is a really big thing. What we've actually done with a number of customers around the world now is using our technology that's installed in our access points, and also some standalone location beacons, they're called. We can actually combine that with a mobile app where we basically load up the floor plans of the actual facility, and you can put in all of your points of interest. So these are the certain doctor's rooms, restroom facilities, coffee rooms, etc., etc. And then make that accessible to your patients so that they can actually rock up, open up their app and say, I need to find this particular place. And it gives them complete indoor style GPS. So as you can see on that little screen where it says integrate with like your digital front door, we can actually tell people exactly where they need to go when they're inside your facility, how long it's going to take to get there, and it's completely accurate inside a building. So it'll have all your corridors and everything in place. So people can really easily find out where they need to go. Now, we can also use that location data to actually help improve the patient experience. So if a user has the app installed on their phone, we actually know where they are in the hospital or in your healthcare facility. We actually know if they're in the building or outside and exactly where they are. So let's say you've got an appointment with a doctor who's actually running 40 minutes late. What you could actually do is actually send them patients a notification and say, hey, your appointment's going to be delayed by 40 minutes. Feel free to go and grab a coffee, and we'll actually notify you via the app when your appointment is going to be. So it means that you don't get people sort of waiting around in waiting rooms and things. They could actually be going off, having a coffee or doing something else until their actual appointment is ready. The next thing there, obviously, to do any of these services, you do need really good coverage inside your building. So Wi-Fi is obviously a very key part of that. And the good thing about that is some of the other technologies now, so things like 5G and Wi-Fi calling, which I know a lot of the carriers in Australia now support, means that inside your hospital, people can still make and receive phone calls on their cellular devices without having mobile coverage. As long as they've got good sort of Wi-Fi coverage, they can still sort of make and receive calls and do anything they need to do. And then, as I mentioned just now, people are looking for what we're sort of saying, that next generation patient room. So giving that hotel style experience into healthcare. So what we've actually seen a lot of places do is having sort of smart interactive screens inside patients' rooms. So they can do things like watch Netflix, they can AirPlay or Chromecast their mobile device screen to that TV, watch their own media and other things like that. So being able to use some really cool technology there. And we've even seen some hospitals take it a step further and some aged care facilities where patients via the TV or via a mobile app can actually go and do things like choose their menu for the week of what food and everything they want, have it on that nice big screen instead of sort of filling in a piece of paper or something like that. So it's really about providing that better experience for patients and guests inside the facility.
Darren, right, before we move on, you were talking about location services and you mentioned aged care facilities. Is it possible, or how would it be possible, because I understand this is a challenge for some facilities where the nature of care is changing, and I'll be open about it. I believe dementia is a bit of an issue, and in care facilities there is sometimes a challenge when residents leave the facility and they don't know. Is it possible to integrate other technologies with Aruba, because I understand how open the Aruba technology is, so that you can use a technology to notify, when a person is about to or has breached, a virtual fence, for example?
Yeah, so that is something that we partner. You mentioned there about sort of the open ecosystem and things like that. We have a lot of partner organisations that we work with in this space. A couple of examples that spring to mind, people like Stanley Healthcare as an example, who actually provide sort of patient tracking technology that can integrate in with our networks. So that, you literally can have this geofencing style solution in place, and you can say, if this person leaves this particular area of the building, then notify whoever that needs to be straight away, issue some kind of alert, so that if a patient leaves the area that they're supposed to be in, people can get alerted straight away, and then the nursing staff could actually go off and find that person. So,
that's awesome.
Certainly something that we do. We do a lot in healthcare and that today.
Awesome. Welcome back, Ron.
Can you hear me?
Yes, we can now.
The wonders of technology, eh?
We just rolled forward, Ron. So if there's anything that Darren goes through that you had the opportunity to not speak about and you'd like to, feel free to chime in. We're rolling through the next phase, and thanks again for making it back. Over to you, Darren.
Look, there is one thing that I would like to cover off before we go further, if you don't mind, and that's about the hybrid theatre stuff. And I think it's pertinent to IT departments and the Aruba network that I've installed. So is it possible to go back to that?
Yes.
Over to you, Ron.
So one of the things I wanted to identify, and I think it's even the next slide, is it the same one? The multi-purpose theatre, multi-purpose, not hybrid. So one of the things that we struggle with is, and if there's any IT people on board, not just clinicals and administration staff, but from a technology point of view, one of the things that we suffer from in a hospital is when you use particular theatres for multiple disciplines. So between each list, you're rolling in and rolling out, or rolling out first and then rolling in different types of medical equipment. So X-ray machines, Olympus stacks that are mobile, our Da Vinci robot as an example. It costs IT departments considerable amounts of time to do things the way we've always done it in the past, that is identifying individual ports within a theatre, and X-ray machines can only plug into that port, and Da Vinci's can only plug into that port. It doesn't work in the modern age because doctors expect the room to be set up the way they want it. They want the virtual reality piece of the Da Vinci set in a certain position, the X-ray in another position. So one of the big winnings that we've had, and we're piloting it at the moment using our Aruba network, is effectively, from an IT department point of view, is a touchless networking. So we can wheel the Da Vinci in and plug it into any port. It recognises that it's the Da Vinci robot. It knows about it, its MAC address, those things. But not only that, it recognises that that's what we've plugged in. So it'll assign the correct VLAN for what that Da Vinci robot needs to get the information back into our system. So one of the big wins we've had here, we've taken about a 3-hour per week administration task, and we have the potential when we roll this out to eliminate that completely. So, and it gives the doctors complete flexibility to set up the room wherever they want. More importantly, the nurses themselves, or the orderlies, when they wheel those pieces of equipment in, they can plug them into a port and know that it's going to work. So that's what we're piloting at the moment. And the reason I wanted to go back to this is, there's that old coin, do more with less. And I actually disagree with that. I think we need to do things smarter with what we have, get the right technology in place, and use it to the extent that it's capable of. Doing things the traditional way is what's going to hurt us from an IT perspective. Only when we identify that we can use things better and deeper and gain efficiencies do the budget constraints become less of an issue, because you can justify why you spend the money. I'm sorry to take you back there, but that one's very important to me, because for me, as a very lean IT department, that's going to provide me with significant savings. Even as much as people moving their desks around within an admin situation, we no longer have to worry about what port are they plugging their phone into for their IP trunks, what port are we plugging the desktops into. That one's a big win for me, having moved to the Aruba kit. So I just wanted to go back there. So thank you for indulging me.
Ron, thank you. You mentioned 3 hours per facility, per theatre, per week. Is that right?
It's across the theatre itself. So 3 hours on average administration across 11 theatres.
So 3 hours times 11. Interesting.
Yep.
Wow.
Oh, no, that's 3 hours for the whole of the 11.
3 hours for the 11 a week. Yeah, wow, okay.
And that doesn't include the time that it also takes, to get from the IT department up into those rooms and redo things. So there are significant savings to be had if we use technology correctly and to the extent that they're designed to be used.
That's interesting. When you're talking about time saving, and you mentioned even just the simple fact of going from one room to then reconfiguring the multi-purpose theatre, Darren, while you were off, has been talking about the wayfinding and the location services and virtual concierge services. Do you find that patients or guests cost a lot of time in asking your staff or specialists where to go and how to get to where they're going? Is that a real world time cost to your organisation?
Yeah, general staff of the hospital, not too many people ask a doctor where to go, which is quite interesting. But if you appear as though you work, in our case in St Andrews, and you wear a uniform, then you do get quite a lot of questions. They'll stop you in the hallway and, where do I find this and where do I find that? You also have to understand your demographic that you're working with. So us here at St Andrews Hospital, our demographic and our patients are primarily in the older age groups, and I'm not going to give you the exact age group, but it's in the older age group. So even pointing someone as to where they're supposed to go isn't always successful. So invariably we find ourselves walking the halls and getting them to the next lift. I mean, we have 7 lifts here, so getting them to the lift that's closest to the doctor they need to. So yeah, it does take a considerable amount of time if you were to add that up over the number of patients through our doors every day.
Interesting, thank you. Darren, mate, if you've got nothing there to query on Ron's point on the multi-purpose theatres, I'm happy for you to continue, mate.
I will do. There's a couple of points on that I'll raise, but I'll just do that in a slide or two's time. So just the next thing I wanted to cover was around sort of looking after the sort of health of the population. So obviously COVID has taught us, I think, a lot that basically we should be able to access services and resources from anywhere. And one of the big things I've seen is telehealth has been a massive thing that has taken off over the last 12 months. If I think back over 12 months ago, you'd book an appointment with your doctor, sort of your local GP, you'd arrive there and quite often be left waiting. And even for a 5-minute appointment, you generally needed, I mean, my local doctor's surgery is probably a 5-minute drive from my house, but sometimes you'd need a sort of an hour round trip. What we have seen is things like telehealth have actually enabled now a lot more efficiency in the doctor's time. So you can actually schedule an appointment online, and then the doctor can call you or have a video call with you and go through and discuss what your issues are. So there's actually a lot of time saving there. And also as well, from a health perspective, if you think about it, most people do not go and see a doctor at their local GPs when they're well. A lot of the people there are actually sick or have something wrong with them. So it's actually a lot safer as well. So being able to offer these kinds of services. And obviously, where Aruba can help here is making sure that if you've got multiple doctors inside your network, it's actually making sure that their video and voice quality is taking priority over anything else on the network. The last thing you'd want to do is be in the middle of a telehealth consultation and having issues with audio or video quality just because a guest, for example, is streaming a Netflix TV show. So there's some very clever things we can do to actually help identify applications and make sure that the business applications have the right priority onto the network. Now, with things like community outreach and expansion of networks, and also zero-touch provisioning of new sites as well. Again, during this COVID period, some of the technology we have here at Aruba has definitely helped a lot of customers around the world. So a couple of examples, over in Italy, they needed to set up some emergency sort of COVID hospitals, and they actually decided to do that on some cruise ships. So we actually helped out there, and they used some of our solutions where, as long as the ship had an internet connection, and these were obviously in dock, so that was nice and easy to do, they could actually roll out access points, switches, and other technology without having to configure anything at all. They just literally plugged the devices all together, and then we went through and automatically provisioned the network as it needed to be. Also for places that needed to have outdoor clinics for COVID testing. I've seen that quite a lot, obviously, here in Australia and overseas. And we actually helped a lot of organisations there where what they actually did was deployed some of our outdoor access points just as an extension of the existing network, which meant that all of the security and everything that they had inside their network was now available out in the car park, or even in some areas we've seen it in sort of sports stadium car parks and things like that. But it meant that they could securely access their data. And when they did tests or anything else from people, they had access to all of the right IT systems and everything else they needed. And then lastly, another way that technology is helping is around home healthcare. So we have seen certain hospitals where patients may actually be better served by being at home because of the actual environment they're in, especially certain things like maybe palliative care and things like that, where it may actually be better for that person to be surrounded by their family, but they may still need access to certain sort of medical information and things like that. So we do have the ability to actually, and this has happened in the States quite a bit, where people have deployed access points actually at a patient's home. That access point is then connected securely back to the sort of the network at the healthcare provider. Over a secure VPN tunnel, which is automatic. And then it meant any monitoring devices that that person has at home are basically connected to the hospital network. And there's complete privacy and complete security there, just as you would get actually inside the healthcare facility itself. So it's been able to provide that better healthcare solution for some people actually at their home, and being able to keep an eye on sort of vital statistics and everything else like that.
So that's not just relevant to hospitals. Well, I see that as being a brilliant solution for regional areas like the Darling Downs region or regional Queensland, where we have you have a lot of individuals who work on farms, for example, may have physical or mental challenges that they need some support with, and it might be an arduous ordeal to get themselves to a facility. So I can see a massive opportunity there for, you call it in-home or even a community outreach centre.
Yeah, exactly. So it's really simple to set this sort of technology up, so that if an organisation needed to have a presence in a remote area, we can literally make it as simple as plug in a 4G USB stick into one of our access points, and that is it. You've got a complete remote office that will securely connect back. So it's really easy for medical staff, for example, to travel around, plug this device in, and they've got full secure access back to their organisation.
Absolutely brilliant.
Now, looking at reducing costs, obviously it's something that everybody is interested in, and there's a couple of really key areas here that Aruba's technology can help people. So cybersecurity insurance is a big thing. So a lot of organizations now will take out cybersecurity insurance. So if they are compromised in some way, whether it's a ransomware and everything else like that, they can actually get sort of some financial protection. But it's how do you actually protect the network itself? So there's a couple of really clever things that we can actually do inside Aruba. So and it kind of goes back to some of the things that Ron mentioned earlier about the multi-purpose theatres as an example. If you've got lots of devices connecting to your network, which aren't your typical mobile phone or laptop / PC, how do you actually ensure they've got the right level of access and are connecting securely to your network? So let's say some of these robotic operating machines that Ron discussed earlier, there'll be certain systems that device needs to access, but there'll also be things that device should never, ever do. As an example, I can't imagine these robots connecting to Dropbox as an example and uploading files, which is what a compromised device may do on your network. So we have some really clever ways of actually giving complete visibility into what is connected to the network, and actually profiling that device itself. So for the technical people on this call, quite often people use things like MAC addresses to identify a device. So they'll say, okay, well, this MAC address belongs to Apple, therefore we know it's an Apple device. Now, the problem with that is, as you're all aware, it's very easy to spoof a MAC address, to pretend to be something you're not. So we've actually taken that a couple of steps further at Aruba, and we actually use a number of different areas to profile a device. So we'll look at MAC addresses, of course, but we'll look at other information about the device that we can get from things like DHCP. But one of the other clever things we'll do, we'll actually see what that device is doing on the network, what resources it's communicating to, both internally and externally. And that enables us to get a really clear and accurate picture of exactly what is connected to the network and what's it doing. Now, what that means is when you plug in your robot device, we can clearly say, this is a XYZ robot surgical device. It needs access to, as Ron said earlier, maybe VLAN 51. Now, that's great for wired devices, but for wireless devices, the way organizations do that today is by mapping the wireless network name, or the SSID, to a VLAN. Now, if you imagine a lot of organizations, you might have a staff network, you may have a guest network, and then quite often we're seeing BYOD networks being added. And then when you get to these IoT devices, theoretically, they should all be on their own separate network. So you're not going to set up a separate wireless network for things like a robot, as an example. So again, we can use that profiling information so that all of your devices can connect to the same secure network. And then we can identify what that device is and make sure that it can only talk to the resources and the services it needs to. So you're making it a lot simpler for the devices to connect to the network, but you've also got all of this back-end security as well. Now, that goes down to one of the points on the screen there about automating these repetitive tasks. As Ron mentioned earlier, if you're having to go into surgeries and manually, or operating theaters and manually configuring ports and making sure things are plugged in the right way, that is obviously a bit of a repetitive task. It's going to take time. As Ron said earlier, it could be up to sort of 3 hours a week just in changing these theaters. But because you've got the human element involved, you've also got the risk that something could be configured incorrectly. So by automating this whole procedure, literally the staff inside the theater can unplug a device in, plug a new device in, and all of that is completely automated. And because it's automated, we can be assured it's always going to be done correctly. And then just one other thing I wanted to touch in around reducing costs is about reducing WAN costs. So if your organization has a number of sites, technology that's available today, such as SD-WAN or software-defined WAN, is a really key way that you could actually help reduce your costs. So instead of connecting your sites via expensive MPLS or private circuits from your carrier, using SD-WAN services, you can actually go and get sort of multiple internet feeds coming into that site, and it can automatically create secure tunnels over the internet. So you've got all of the security you need at a vastly reduced cost than some of the private services available today. So it's a real way we're seeing customers deploying sort of networks in a different way to actually have some massive cost savings.
Just on that, Darren, that doesn't necessarily equate to a permanent facility, does it? Because Ron mentioned earlier, if there is an intervention from the government regarding, say, for example, a vaccination rollout, he may have to stand up a new site or branch or what have you for a certain amount of time and then shut it down again. With Aruba's SD branch and SD-WAN capabilities, the stand-up of a facility or an in-home facility or a small branch or a community outreach centre, that can be stood up pretty quickly and securely, can't it? And then taken back offline again when it's no longer required. Is that fair?
Exactly, yeah. It could literally be minutes. So you could literally have one of our little gateway devices that does have sort of LTE built in, or you could just plug in a 4G dongle. As soon as that device has internet connectivity, it'll connect to the cloud, download its configuration, and literally within maybe 15 minutes from turning it on, it's connected to your site in a secure manner. And again, If you need to move it to a different site, it's just that same process again. So really, really simple and fast to actually do.
Simple doesn't mean that it's not powerful. You've abstracted all the power and made it very simple by the sound of it.
Exactly, yes.
Great.
Just moving on now, obviously it's important to provide some of these services to your patients and things, but it's also like, how do you actually ensure that the people who actually work for you, their well-being, and how do you ensure they're most effective in their job? So a couple of cool things that we can actually do here. So I mentioned before about the application priority side of things, so being able to prioritize these business applications easily on your wireless network. One of the other things we did recently though at Aruba, to enable people to return to offices as an example, is anybody that used one of our Aruba network management tools, we actually introduced a contact tracing solution for them completely free of charge. So what that meant is we would actually start collecting data about the devices and things connected to the network. And this is for Wi-Fi based contact tracing. So most people obviously keep their mobile phone on them, so that's typically a good device to trace. But we could actually see exactly where that device has been and what other devices they've been in the vicinity of and for how long. So if you imagine you're a sort of large organization with multiple buildings in a site, if somebody tested positive for COVID, what was happening previously is the whole facility would shut down and a deep clean would happen everywhere. What our solution enabled us to do is actually exactly see where that person had been in the building, what levels they'd been to, what buildings they'd been to, so that we only had to undertake cleaning in them particular areas. We also introduced an enhanced solution as well that uses some Bluetooth tags that are basically issued to staff and visitors. And that gives us a really, really accurate picture of exactly where that person has been. And in fact, one of our customers that used that, the Walter and Eliza Institute for Medical Research in Victoria, they were actually one of the leaders in researching for COVID vaccines. They've actually been using our Bluetooth-based contact tracing solution for quite a while now, while they've been researching this COVID vaccine. So,
sorry, Darren, when you say really, really, really close, I'll use the word proximity, are we talking a few meters?
With the Bluetooth solution, it's sort of within a meter.
Oh, wow. Okay.
So if you've been within a meter of somebody when you're using the Bluetooth solution, then we can clearly see where you are. And our solution gives you lots of other mapping technology as well. So you can bring up maps of your buildings and see exactly where people have been moving around them, what the hotspots are, even down to some of the rules around how many people per square meter. You can put all them alerts in and get alerted if there's too many people gathering in one place. So some really, really clever things we can do there. And then lastly, going back to a point that was made earlier, what Ron mentioned about things like wheelchairs and other assets and how to actually find them. Using this same Bluetooth technology, we've actually got an asset tracking solution that just uses the Bluetooth technology built in our access points and then these simple asset tags that are attached to devices so that you can actually locate where these devices are. So let's use wheelchairs as an example. You would attach one of these tags to the wheelchair, and then via a mobile app, your staff can actually open up the asset tracking app, type in what they're looking for or select from a list, and it'll tell them exactly where the closest one is and can give them directions of how to get there. You can also use the geofencing capabilities as well. So you might say, if a wheelchair leaves our actual building, and you might have a little area by reception for people going out to their car, but if it leaves that area, then raise an alert straight away so that people can actually go and intervene and grab that asset before it actually disappears. And for some of the more obscure devices you might want to locate, I mean, a wheelchair, quite simple, everyone knows what that is, but you've got the ability to actually take a real photograph of that actual asset. So if it's some obscure monitoring machine, and if you tell a member of staff to go and find that machine, they might not know what they're looking for. But if they can actually open the app up and it says, hey, it's in this cupboard here, and here's what it looks like, a real easy way to actually locate these assets, which is obviously a big cost saving as well. As Ron said, if it's $6,000 for a wheelchair and you can save buying some of them every year, you can actually use them that cost and that money to actually improve healthcare and things like that. So summing all that up, just before I hand back to Dean and Ron, as you can see, there's lots and lots of different ways that we can actually use technology and I've only touched on a number of them here, but to actually help provide both a safer and a better experience, not only for the patients and visitors to your facilities, but also your staff as well. So there's a couple of areas here I haven't touched on, and there's lots of other solutions that are available from some of our partner companies. But if anyone has any other questions on that, feel free to reach out to Dean from Arion, who's on the call here, and we can obviously assist you any way we can. And with that, I'll hand back to you, Dean.
Darren, thank you. I have a couple of questions on your previous couple of slides. I won't move back because this is a summary slide we have here. I'm very interested in understanding your perspective and Ron's perspective on how you're tackling the differential between the pace at which the applications are entering a network. So video, streaming media, we talked about Netflix, Stan, a better patient experience, virtual delivery, etc. But yet you've got most organizations are on a 5 to 7 year life cycle on their network infrastructure. Ron alluded to his joining the organization and having a challenge, a real challenge with having a supportive network infrastructure. How can someone deal with that?
So one of the ways we're actually doing that is obviously making sure that our software and technology inside the actual hardware and things that we've got is kept as up to date as possible, and using some really sort of clever features. So as an example, we've just introduced a new version of our cloud management tool, Aruba Central, this week to all of our customers. And what we continually do is roll out new features and new sort of new technology to these existing customers at no additional cost. So just to give you an example of a couple of the areas there, one of the things we've just introduced is some of this device profiling information available to all users. So what they can do now is simply see exactly what kind of devices are connected to their network. So instead of seeing a big list of usernames and passwords, we'll actually show them what kind of devices it is. So we might say, you've got 100 Windows PCs you've connected, you've got 35 iPhones and other things like that. So they can get a really clear picture of exactly what is connected. That same platform as well does full inspection of all of the different applications that are available on the network as well. So again, organizations can get a really clear view of exactly what sort of traffic is on their network, and then create appropriate rules and policies around that. So things like making sure Netflix maybe doesn't run on your staff network, but obviously is allowed on your guest network, as an example. So some really, again, simple ways for people to actually configure this. Very, very powerful tool, but we've just made it really simple for some of these solutions to actually run over the top of it.
Okay, Ron, do you find that the patients are now demanding different services? So even in care, in the facility services, are you getting demand for personalised delivery of Netflix, or can I use my own iPad while I'm here?
Yeah, look, it's relevant that you bring that up, and I wish we had have scripted that one, because I could have given you a list as long as my arm. But look, to be honest, it's the things that you don't think about that are going to hurt you. And I'll give you an example, a real life example of what we struggled with here for a while at St Andrews prior to having our Aruba kit here. We were taking a massive hit on our network speed, our internet speed, and we couldn't narrow it down. And then when we went to our new Aruba kit, we were able to do a little bit more analytics on it. One of the things we found, and it's always the things that you don't think of. We had, at one point in time here, we had 3 people in hospital on their iPads streaming their security service from home. So
their security service?
Yeah, like the video cameras. We had one lady that came into the hospital over a week, and she was quite literally monitoring her house while she was in hospital. She would flip between different cameras and she would stream it live in HD, I don't mind telling you. So from a technology point of view, we always concentrate on how we're going to enable business, but it's the things you don't think of. It's the things that catch you out. The ability that we had then with the Aruba kit was we were able to adjust very, very quickly and accommodate that. But I don't mind telling you, without the analytics in the back of it, without being able to identify easily what your traffic is and what it makes up, it's almost impossible sometimes to work out what's hurting you. So again, this comes back to the point I made earlier about using the technology you have to the depth of what it was designed to do.
Be
actually
smarter.
That's actually a really good point, Rod. Again, some of the other new features we introduced just this week was some advanced AI around the actual management of the network. So if you've only got a small IT team, you're not going to be sort of absolute gurus when it comes to Wi-Fi and RF as an example. What we've actually done is taken data from a lot of our customers and made that easily accessible so that we can actually advise you straight away, hey, you might see some network improvements if you do X, Y, and Z. So taking a lot of that experience we've got in this area and making that available to every single one of our customers, it just means you can get a better running network or a more efficient network, and you can actually respond to issues and things a lot quicker.
Yep, 100%.
Wow, thank you. Team, I've just realised we are on the hour. I have been handling the questions as we go with our Better Care at the Edge session. And straight to our thank you slide. We are on the hour and we have to shut off on time. Extremely insightful. I can't thank you enough, Ron, for practical understanding of what happens within your organisation. And Darren, thank you very much for enlightening us with Aruba's investment and innovation. Not to shine the torch on Arion too much, but we are heavily involved in turning what Aruba manufactures into reality, into organisations that the likes of Ron represents. So thank you very much, team. I genuinely appreciate the effort you've put into making today's session such an insightful event. And to those of you in the audience, thank you for attending. And for those of you who haven't been able to attend, we will be emailing the session and making it available to you. So I will shut today's session off. And again, thank you, Darren. Thank you, Ron. Greatly appreciate it. And those of you in the audience, greatly appreciate it. Thank you very much.
Thank you.
Thanks, everyone.
Thank you.